right around here, coming out to the top of the shoulder, right on top of the humerus. So the coracoid process is going to be right under there. Feel that? Okay, so about right under there. So way out here laterally, okay? So the fibers are coming from here, about here, right on the front of the thorax, up to the coracoid process, right? And it's like 3 little fingers of muscle that come up, okay? So how are we going to work that when we have a female client, right? Breast tissue is right over top of that. But this is a muscle that often gets overlooked for just that reason, okay? Because it does take a little maneuvering to be able to get to it, but you absolutely can get to it, okay? So the first thing you want to do is we're going to abduct our client's arm, okay? My intention here is to go in underneath pectoralis major, because that is the superficial muscle. Pec minor is the deep muscle here, and up onto the ribs, okay? So in order to access the point at which I need to sink in, it's coming right below the lateral breast tissue, okay? You can use a towel or even a sheet if the client is more well endowed and a pillowcase isn't gonna, cover everything. And all I'm gonna do is I'm gonna fold the pillowcase up, not exposing any breast tissue, but this is the area where I wanna get, okay? Now I can just hold this here, or an even better way to deal with this is to have the client, I'm gonna have you take this hand, grab your side of your breast, pull your breast tissue towards you. And do you see how that just moves it out of the way? And now all I'm getting is the skin and the pec major muscle underneath. See this right here? This is pec major, okay? This pec major comes across the anterior chest wall and over into the humerus. So this is pec major. I want to be underneath. And can you see the borders of it, right? See how my thing, so I'm going to be going up underneath that. Pec minor is sitting right up underneath that, going this way, okay? So I'm going to have just a little bit. I don't want too much lubrication here because I don't want to be sliding, okay? I don't want to be sliding. I just want to reduce a little friction, okay? So what I'm going to do is, just when you get with your client, I want you to palpate a little bit, okay? There's a big difference between here and here. When I sink in here, the muscle tissue coming around here is much thinner, and I'm gonna hit her rib cage really quickly there, right? That's gonna hurt. I wanna make sure that I'm up more superior along this lateral thorax, okay? Now, I don't wanna be in here. What's this? That's an endangerment site, right? So deep in there is the endangerment site. So I don't want to, my direction, I'm going to be close to it, but I'm going to be going in and up instead of into the endangerment site. So it's important, don't be scared. You're not going in like this, you're going like this, okay? You can see how this is latissimus dorsi. You can see it's nice and fleshier here, okay? So when you're trying to palpate the right spot, just make sure that you're not here down on the thinner muscle right here at the ribs. You want to be able to, this fleshier part here. And you'll see pec minor here, and you'll see latissimus dorsi here, and you want to be right in between that, okay? So what I'm going to do is, and if you have ticklish clients, then you need to do this with all your clients, but especially ones that are ticklish. If you're in here poking and prodding and you're unsure, they're going to be moving and it's going to be irritating. You need to do this with some confidence. Once you decide to do it, just do it. Okay? So what you're going to do is go in until you feel the rib cage, and then slide your fingers along the surface of the rib cage and go up onto the rib cage as far as you can go up. Pec minor is right there. It's a thin muscle. You probably won't actually feel the muscle tissue because in most people it's not very defined. It's one of those things where you have to know where it is. I'm sorry if this is uncomfortable. It is not the most comfortable thing to have done. But you're going to go this way with your friction. This is longitudinal friction because I'm going with the fibers. And then I also want to do transverse, which is across the fibers. So go up and down, up and down, and down. And all I'm doing is I'm following the contours of the rib cage, okay? Try to go up. Once I'm past the axilla, then I can kind of curve my fingers in towards more.
I don't know the breast reduction. You can still do that.
Well, once everything's healed, you can have all of this done. Okay. And then just let your fingers gently slide out. Don't just pull them out, right? That's a little abrupt, right? So you just want to let your fingers just, and then give the side of just a little effleurage, okay? Little effleurage there. Careful that the breast tissue is not touched, okay? Okay. And we can fold this back over, and then as you see, I can't get all the way up to the coracoid process there on most people. It's very unusual that you could, okay? So what I'll do is I'll come in, and now you can put this back if that's okay. Do some warm up, okay? Because you're going to have to sink in a little deeply. Okay, a little friction. This is your ulnar friction, works really well in these rounded areas, okay? And then here's your clavicle, and I want to sink in right underneath the clavicle, and just get in there and do a little friction there where the insertion is, okay? This is one of those things, you're not taking an elbow on something like this. You have to use your fingers, you have to use your hands for this, right? Your elbow is not going to fit down in there. Okay, your elbow's really, unless you have a really, really, really skinny elbow, right? And nobody wants you sticking their elbow here, okay? You wouldn't be able to get your elbow up underneath pec major anyway, okay? So don't forget that all of this underneath the breast tissue is getting the muscle belly, but don't leave out the insertion here. Come in and work in here, okay? Questions?